I'm Dr. Chobanian, Susan Chobanian, and I would like to talk about scarless rhinoplasty. Virtually 100% of all the noses I do are scarless. It's basically a closed technique. The surgery is all done from the inside of the nose through the nostrils. There's no cutting on the outside of the nose across the base of the columella. There's no cutting around the nostril, and there's no cutting underneath the lip. There's no scars or stitches on the outside of the nose. All the work is done through the nostrils on the inside, whether it be for breathing or cosmetic purposes or both. Scarless rhinoplasty or closed rhinoplasty I've been doing for over 25 years. And whether you're considering a primary rhinoplasty, a nose that's never been operated on before, or if it's a revision rhinoplasty, the closed technique has many advantages. Even if you've had a previous rhinoplasty where it's been cut from the outside once or twice and the scars are unsightly, I can camouflage the scars or improve the scars through a scarless or closed rhinoplasty. My patients who undergo closed rhinoplasty have improved healing, faster healing. There's less bruising, less swelling, less black and blue. Most of the bruising and swelling is gone in 3 to 5 days. By the time we take the bandages off in 6 or 7 days, the swelling is practically completely resolved. The cast or the bandage literally floats off the nose, and the patients are ready to go back to work. They don't have that avatar look where they can't be seen by the public. They look perfectly normal. The advantages of a closed rhinoplasty is also for very bulbous or meaty noses. Patients who have very thick skin, very oily skin, the closed rhinoplasty improves the skin's ability to contract and create a nice slim nose. With my technique of scarless closed rhinoplasty, I can reduce the bulbousness of the nose by approximately 50% or more. Patients who have very long noses, very long nostrils, the scarless rhinoplasty allows me to bring the nose closer to the face and reduce the size of the nostril up to 50%. My patients for closed rhinoplasty are also very happy with the skin texture and color, which stays the same. They don't lose any sensation. There is no numbness to the tip of the nose. The scarless rhinoplasty is particularly favorable by men. Men in general are very self-conscious about having plastic surgery or having cosmetic surgery. If there's any scars or stitches on the outside that shows on their face, they're very self-conscious about that. They don't like to have people know that they've had cosmetic surgery. So the scarless rhinoplasty is particularly good for my male patients because they, number one, they do have thick skin. A lot of them have bulbous tips, and this technique allows them to go back to work and get back to the gym. Most of my patients go back to work in 1 week. They get back to the gym in at least 2 weeks. So if you're considering rhinoplasty, whether it be a primary rhinoplasty or if you've had a previous rhinoplasty and you have scars on the outside of the nose, I would like to see you in consultation so we can discuss in depth how we can improve your nose, what changes you want cosmetically or functionally to improve the breathing, and we can do it all without scars from the inside. We'll do a complete consultation in detail with your photographs. We'll discuss exactly what changes you want. We'll review your photos, and you can make a good decision on what kind of technique that would suit you best.